Yes. So I think hip replacements, and I thought, they've said, what is the operation of the century? So you just said it was the one of the past, but it's actually been coined the operation of the century as hip replacement. And you say, why would you coin this operation as a century? Why? I thought it would be cataracts or something like that. But because you can give people's mobility back, you give them their function back. And we actually are, and I have patients like that. I never thought it was possible. And that's our big dream, and the whole thing in the hip arthroplasty idea is to get patients to a forgotten hip. So you do a hip replacement and you walk up to a guy a year later and say, which hip was done? And they don't know. They can't immediately tell you. So that's the level which hip replacements has changed to. The problem is that it's also been initially, the hip surgery was done by everyone. And so the function wasn't expected. We just wanted to take pain away. But the risk of dislocation, all these things. So now you have an easy approach, cut muscles and do this hip replacement, and anyone can do it in any town. Or you can level up to a place where you can do a hip replacement, which people have a forgotten hip.
Shall we just go step back there a little bit? So go through muscles. You're talking about the posterior approach where they go through gluteus muscles, or what do you refer to?
So there's three different approaches. So the big one, the most common one was the Harding approach, which you lift up the gluteal muscles to go into the hip. The posterior approach was then a better one in the way that you don't cut muscles, but then it also was deemed to have a higher chance of dislocation. Understanding why dislocation is that the ball of the hip replaced hip is smaller than the normal one. The smaller the ball, the less the wear. Then you get longevity. But now our plastics and everything has changed, so the ball is now get to an average of about 32, where traditionally it was about a 28 and even 22s. But a 20, so that's just the size of the ball. But now we know about how to put this thing in, so the dislocation rate is much less. We get restore the center of rotation and get this hip to be feeling normal.
So adjusting the technique has given us all these improvements.
So there's muscles, and then the approach, which I in 80% or 90% of cases use, is now the direct anterior approach, which we don't cut muscles. So it's a shorter cut, but it's not about the length. It's just that you don't do soft tissue damage. You literally don't cut any muscles. You only cut the capsule, which is the lining around the joint. That's all you do.
And hence why they recover so quickly.
Yes, yeah. So we are now sending patients home the same day after hip replacement. So that's that. But the nice thing is the fast function, get back to mountain biking, all these things, doing Cape Epics, those type of things you can do with a hip replacement.